The first trimester of pregnancy is a crucial period, marked by rapid changes for both the mother and the developing baby. It extends from the first day of the last menstrual period until the end of the 12th week of pregnancy. In fact, by the time a woman realizes she is pregnant, she may already be 5 or 6 weeks pregnant. This first trimester is characterized by an extremely rapid development of the baby, as well as significant physical and emotional changes in the pregnant woman. Baby's development. From fertilized egg to embryo. The fertilized egg rapidly divides into layers of cells that implant in the wall of the uterus, where it continues to grow. These layers of cells form an embryo. Rapid growth. The baby grows faster during this trimester than during any other period. Organ formation. By the 6th week, a heartbeat can usually be heard, and by the end of the 12th week, the baby's bones, muscles, and all body organs have formed. The baby then looks like a tiny human being and is called a fetus. He or she even begins practicing swallowing. Fetus size. By the end of the first trimester, the fetus is about 8.5 centimeters, approximately 3.5 inches, long. It is comparable to the size of a kiwi. Importance of folic acid. Folic acid is essential during this trimester to reduce the risks of neural tube defects in the baby. Changes in the mother. Physical changes. The pregnant woman's body undergoes many changes during this trimester. Cardiac output increases, and the body works harder. Fatigue. Fatigue is one of the most common symptoms of the first trimester. The body is working as if it were running a marathon. Nausea and vomiting. Nausea and vomiting, often called morning sickness, are very common during the first trimester but can occur at any time of the day or night. It can last from the 4th to the 9th week. Food and smell aversions. It is common to develop aversions to certain foods or smells. Breast tenderness. The breasts often become sensitive, full, and swollen due to hormonal changes. Frequent urination. The frequency of urination also increases, as the kidneys work harder and fluids shift. Heartburn. Heartburn is common due to high levels of progesterone, which slows down gastric emptying and relaxes the esophagus. Constipation. Constipation is also common due to progesterone, which slows down the emptying of the intestines. Cramping. Cramping may occur as the uterus expands and ligaments relax, which is normal. However, severe, one-sided cramping with bleeding may be a sign of an ectopic pregnancy. Bleeding. About 30% of normal pregnancies may experience bleeding or spotting during the first trimester. While this can be normal, it is essential to consult a doctor to rule out miscarriage or ectopic pregnancy. Care and advice during the first trimester. Rest. It is important to rest and take naps. Hydrate. Make sure to drink plenty of water. Nutrition. It is recommended to eat small, frequent meals and bland foods to relieve nausea and vomiting. Ginger can also be helpful. Spicy and fatty foods can worsen nausea. A balanced diet is recommended, even if food aversions can make this challenging. Prenatal vitamins. Taking prenatal vitamins, especially folic acid, is crucial for the baby's development. Folic acid reduces the risk of neural tube defects. Avoid certain foods. Raw foods, including raw meat and fish, unpasteurized dairy products, and deli meats, should be avoided due to the risk of bacteria. Large fish, such as king mackerel, swordfish, and big tuna, should be limited because of their mercury content. Limit caffeine. It is advisable to limit caffeine intake to less than 200 or 250 milligrams per day. Medications. Acetaminophen, Tylenol, is considered the safest pain medication during pregnancy. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, should be avoided. Physical activity. Physical exercise is important, but intense activities or new exercise programs should be avoided. Exercises such as walking, prenatal yoga, and swimming are recommended. It is important to stay hydrated during exercise. Activities with a risk of trauma, such as downhill skiing or horseback riding, are recommended to be avoided. Stop smoking, drinking, and marijuana use. Smoking, exposure to tobacco smoke, alcohol, and marijuana consumption should be stopped because these substances can be harmful to the baby. See a healthcare professional. It is essential to see a doctor or midwife regularly to monitor the pregnancy. If symptoms such as nausea, vomiting, cramping, and bleeding are worrying, or if you have trouble staying hydrated or nourished, it is important to seek immediate medical attention. The first appointment with a midwife usually takes place between the 8th and 10th week of pregnancy. Frequently asked questions. Weight gain. It is not necessary to gain much weight during the first trimester. Most of the weight gain occurs during the second and third trimesters. Weight gain can vary from 15 to 30 pounds, depending on pre-pregnancy weight. Cramping. Cramping is normal due to changes in the uterus, but severe cramping with bleeding should be reported to a doctor. Bleeding. Bleeding can occur in a normal pregnancy, but a doctor should be consulted to rule out a miscarriage or ectopic pregnancy. Foods to avoid. Raw foods, unpasteurized dairy, and certain types of fish should be avoided. Exercise. Exercise is important, but intense activities or those with a risk of falling should be avoided. In summary, the first trimester is a period of rapid development for the baby and significant changes for the mother. It is crucial to take appropriate care to ensure a healthy pregnancy. Regular visits with a healthcare professional, a healthy diet, appropriate physical activity, and avoidance of harmful substances are essential during this period.